We are getting answers to your vaccine questions. Joining us now is Dr. Ulysses Wu, an infectious disease specialist at Hartford HealthCare. And Dr. Wu, thank you so much for being with us.
Thank you for having me again.
So let's get right to it. Roberta from South Windsor is asking, I heard once you have your second dose, it's effective for 6 months. Is that true? And will it then become necessary to get another 2 shots?
So I think Roberta is very smart because she's been keeping up to date on some of the new information. And so there was recent literature that would support that 6 months, that you have robust immunity after your second shot for at least 6 months. But remember, this is still a fairly young disease, and so they're still investigating how long you can have that immunity. My suspicion is that it's actually going to be longer than 6 months at this time.
Well, that would be some good news. We're going to keep our fingers crossed on that. The next one coming from an anonymous viewer. If you're considered fully vaccinated, why do you still need to wear masks and avoid crowds?
So that's a great question, because the whole purpose of the vaccine is not to get the disease. But as we know, it's not 100%, and you can still get the disease. And if you are exposed to a large amount of virus, even though you have been vaccinated, in certain situations, there's the possibility that you could still get the disease. And the other issue is that you could become a carrier, though there is some science that supports that maybe this is not as much of the case, but we have not proven that. So we may not get it, but we can become asymptomatic even though we're vaccinated and pass it on to our loved ones who may not have been able to get the vaccine or may be more susceptible. So definitely, we still need to wear the mask. We still need to socially distance and avoid crowds.
Okay, that makes a lot of sense. And last question, this is coming from Wayne from Wethersfield. And I actually hadn't thought about this, but it's a great question. With mosquito season coming, if a mosquito bites a person with COVID and then bites someone else, could they possibly transfer the virus from person to person?
Wayne from Wethersfield is asking a wonderful question at this point. I don't think so. Anything is possibly transmitted through the blood. But remember, this is a disease that is a respiratory-borne disease. That is how it affects us. That's how it gets into us. And so it is very unlikely that mosquitoes are going to be unable to, it is very unlikely they're going to be able to transmit coronavirus through biting you.
All right, that is good to hear, especially since the mosquitoes tend to love me and my Irish blood, apparently. Appreciate your expertise, your knowledge. Thank you for taking time out of your busy day to be with us, Dr. Ulysses Wu with Hartford HealthCare. Thank you so very much.
Thank you.